Good evening, everyone, and welcome to Just a Little Talk. We are so happy that you have decided to join us on today. We thank God for all of you who are watching and listening with us on today. I'm excited about our segment on today. We have a very important person with us, and I just know that because of her expertise and because of her knowledge, we are going to be blessed this evening. And so we are so happy. We're so happy for our segment on today. Important things that we need to know about getting vaccinated. I know that many of us and many people have questions about getting vaccinated. And so we have with us today Dr. Rupali LeMay, who is a vaccine specialist at the Johns Hopkins Hospital. And so I, know that she's going to come today and shed some light on us getting vaccinated. And so once again, I want to thank you for joining Just a Little Talk on today, and know that Just a Little Talk will make everything all right. And so, Dr. LeMay, we are so happy to have you today. Just come on and just tell the audience a little bit about yourself.
Yes, thank you so much, Reverend Little, and thank you for having me. So, as Reverend Little mentioned, my name is Rupali LeMay. I work at the Johns Hopkins. I'm actually at the School of Public Health, and I have been spending probably about the last 6 or 7 years working on vaccine issues and really talking to parents, talking to providers, talking to individuals about why and how to make a decision related to vaccines. Prior to that, about the last 15 years before that, I worked primarily in HIV and AIDS, mostly in sub-Saharan Africa, and I have a PhD in public health. And so I'm here today. I was able to connect with Reverend Little on a different conversation earlier this week. And so I'm really glad to be here today and to help you think about the vaccine and really talk to you about any questions that you may have about the vaccine.
Thank you so much. Thank you so much. I was with her I think on Thursday. We was in a meeting on a Zoom call on Thursday, and so I just was so elated with the information that she shared, and so I just had to reach out and get her and try to have her to come on our show. And so I knew it was a last minute thing, and so I asked her if she should come, and so she decided to come. And so we're so happy today because I know that this is a topic that we all need to know. And so thank you once again, Dr. Rupali, for being on today, and just at the last minute for coming on and sharing with us on today. Amen. Thank you so much. Listen, why is it important? Why is it important for us to receive the COVID-19 vaccination? I'm sorry.
Yeah, no, it is a great question. And I think it's a question that a lot of people have. Unfortunately, I think at this point, most of us either know someone that has been infected or affected, or has had a severe case of COVID or has died. When this virus was introduced in late, I'm getting my years messed up now, 2019, when this first started circulating around the world, individuals, and especially those of us working in public health, we weren't really sure. We'd never seen a virus like this before. It spread very, very rapidly, as I'm sure many of you know, spread very rapidly throughout the world. And we saw huge cases and a number of individuals, especially dying, unfortunately, starting in China and then moving over to Europe. If you remember earlier on in the pandemic, Italy was hit quite badly. And then here in the United States, we started seeing cases. And part of the issue as to why it's so important to get a vaccine is that, first of all, everyone is susceptible, which means that anyone can get it. It doesn't, stay within borders. It does not affect certain people. It doesn't affect certain races or certain income levels or education levels. It has really infiltrated literally every single segment of society. The other piece that it's also why it's important to get a vaccine is that it's quite severe. The problem with this specific virus is that we're just learning about it every day. And so as a result, so far, it has caused a lot of severe complications, particularly with people that have underlying conditions. And so part of the puzzle from a scientific point of view is trying to understand why certain people that get the virus fare much better than others. We're hearing and we're learning a lot from people that got the virus very early on in March and that still have symptoms and still are unable to be able to breathe correctly, or still having problems with blood pressure. And so to me, those two things alone, the fact that everyone is susceptible and the fact that it can be quite severe in a number of cases leading to death, really points to why it's really important to get the vaccine. Because what the vaccine does is it provides you with some protection, which then essentially then provides your community with some protection. So that's your family, that's people that live in your community, and anyone else that you might be in connection with. And so that's why it's really important for individuals to get the vaccine. And we're very lucky to have a vaccine, several vaccines, I would say, that were developed very, very rapidly. However, I would say that have been developed, even if they have been developed on a rapid schedule, they were developed still using the same type of safety protocol and effectiveness protocol that any other therapeutic product. So any other drug that you might take, for example, if you perhaps have high blood pressure, if you have high cholesterol, it went through the exact same process with regards to examining it for safety issues, making sure that it was effective in different segments of the population. All of these vaccines have gone through that exact same robust and rigorous process. And so I can say with certainty, especially those of us that work in vaccine science, that it is a safe product, the products that are currently available, and they have been rigorously tested and evaluated. And so really, it's really important for individuals to get the vaccine so that we can eventually really not living the way that we're living, being at home, not being able to see our friends and family, continuing to use social distancing and face masks. By getting the vaccine, we're one step closer to going back to pre-pandemic and more of a normal life, I would say.
Okay. You just said something very important. I was listening, and you said that some of the people that first got COVID, that they are still feeling some of the symptoms. Been almost a year. And will they continue to have those symptoms for the rest of their lives?
And it's a great question, Reverend Little. And that's part of the issue as to why we're trying to figure out how to prevent people from getting it in the first place, right? We have some people that recover very quickly and are doing fine. And then we have other individuals that might have had a mild case, but are still struggling with some of these symptoms. And as I mentioned, part of it is that it's a novel virus. And so we don't yet know all of these long-term effects, right? So I can't really tell you with certainty, if they'll continue to struggle with these, for the far future, if it's the near future. And that's why I think it's even more important to get the vaccine so it can prevent you from getting it in the first place.
Correct. Thank you so much. Very, very important there. What are the risks and benefits in receiving the vaccination? I know that there are a lot of risks and there are benefits. And so what are some of the risks and benefits?
So I think just like any other drug that you might be prescribed by your doctor, right? As I mentioned before, if you happen to have high blood pressure, or if you have high cholesterol, or if you, if there's any other type of drug that you end up taking, usually that is prescribed and recommended after thinking about the risks and the benefits. I would argue, particularly for the vaccines that are currently available here in the United States, is that the benefits greatly, greatly, greatly outweigh any sort of risk. Most individuals that get the vaccine, the vast majority of individuals will not have any sort of risks associated with them. There are, some individuals have some side effects from getting the vaccine. So for example, what we have heard, especially in the clinical trial, as well as individuals that have gotten the vaccine, we have heard that some people might have a sore arm, you might get a fever, you might have chills for a few days, so you might have pain at where the injection site was in your arm. But in general, unless there is some indication that you would not be able to tolerate the vaccine well, particularly for the COVID-19 vaccines, that the benefits greatly outweigh the risks. Now, with that being said, as I mentioned, it's like any other drug that you would take, right? So let's say that you do take a blood pressure medication, and some people have a hard time tolerating that. However, again, the benefits of that and the reason why a doctor would prescribe that medication to you is because they believe that the risks are very small compared to the benefits. And I would say the reason, again, this vaccine is recommended by the CDC, is recommended by doctors, and it's because it's the same case that the benefits very much outweigh the risks.
All right. Thank you so much. Thank you so much. Many are skeptical about taking the vaccination because they feel that they are being used as guinea pigs. Can you please enlighten or relieve the fear of those who are still skeptical about the vaccination?
It's a really good question, and I understand why people have concerns. As I mentioned earlier, I think that many people are worried about the vaccines because they feel as though they went through a very quick process with regards to development, especially if you think about other vaccine development timelines. However, I would argue that for people that are worried about that in terms of being guinea pigs, remember the trials that have gone on since almost the last year now when the first trial started that we're testing different candidates for vaccines is that this wasn't tested in just a small number of people. I think one trial alone had something like 40,000 individuals where this vaccine was tested. And so that is one thing that I would say that I would really take some solace in. This was not tested among a small part of the population. It was tested in huge parts of the population all over the world. It was tested in different age groups, in different races, in different education status, in different underlying conditions. And so as a result, because we're in a pandemic, I think that because there have been so many vaccine trials that have been ongoing, we have been able to see that this has been tested already in thousands upon thousands of people. And so I think that, people do not need to perceive it as sort of a guinea pig vaccine. It really has been tested in a huge, huge number of people. And again, the reason that it would be recommended and it would make it to the population is that through independent safety monitoring, as well as looking at effectiveness, the products were deemed safe and effective. So that's the only way that they would become available to the public. And they were deemed safe and effective.
And I know that this virus has killed many African American people. What is the reason why this virus is so effective in killing African Americans?
One of the problems with this virus is that this virus is a respiratory virus, which means that it is going to affect the respiratory system. And part of the issue as to why we're seeing really a huge disproportionate amount of Black Americans being infected by this is because it also has to do with, unfortunately, Black Americans also face a lot of other underlying conditions. So for example, Black Americans are more likely to unfortunately be susceptible to asthma. Other respiratory conditions, COPD, I'm trying to think of other common sort of respiratory conditions. And so if you already have a respiratory condition, this virus essentially makes it worse, makes it more severe and complicates it. And so that's why we have seen such different numbers when we look at race, when we look at number of people infected, and then we specifically look at severity of the virus, is that African Americans have unfortunately fared extremely poorly in this. And that's because of other underlying conditions. And so it's a real challenge, I think, when you think about vaccination and why it's so important for African Americans as well as other minorities to be very transparent here to get the virus because they are more susceptible due to other underlying issues.
Okay. One of our viewers has a question and she said, can an individual die from the vaccine because someone has said that a person has died from taking the vaccine?
So it's a great question. I think what they might be referring to is there was, I believe, last week, and maybe it was in the news that perhaps a doctor had died after getting the vaccine and they were trying to figure out why. So again, my answer to this would be that for the mass, like 99.9% of people are not going to have any issues with the vaccine. I think that's why it's so important to be able to talk to whoever you trust from the healthcare system, whether that's your doctor, whether that's a pharmacist, whether that's a nurse, whoever it is, so that you're able to understand and discern if perhaps that you have an underlying issue or condition that might put you at risk for a severe complication from the vaccine. And so, but again, I would argue, what we have seen and the testing and the safety that has gone on in the trials, the vast majority, the huge vast majority of people will not have any sort of severe consequence.
All right. The next question is a very important question. And I think that this question, many people really want to know. According to the CDC, at least 5.9 million people in the United States has already received at least one dose of the 2 doses of COVID-19 vaccine. Why is it taking so long for people to be vaccinated?
It's a great question. And I think that part of it is the way that our vaccine and public health infrastructure process works here in the United States is that the Centers for Disease Control, so the CDC, can make a recommendation. So for example, in this case, they can say, people should get this vaccine. We're now going to tell you how people should get the vaccine with regards to rollout. And so what they have tried to do is come up with a plan to think about allocation so that it's equitable and that the vaccine is first being offered to people that are more susceptible or at higher risk of having severe COVID. Now, the issue that is really happening with rollout is that states then can take that recommendation from the CDC and implement that recommendation. However, that is done on a state-by-state basis. So one state might say that, yes, we're going to very much prioritize healthcare workers and those that are living in long-term care facilities, so individuals that are in that 1A category for prioritization, while another state might say, we're first just going to focus on healthcare workers first. Then once we have all of the healthcare workers done, we will move on. Part of the problem with all of this is that means that there's not a coordinated response. And so, we have heard, and we've heard from colleagues of ours that work at different state departments and different states outside of Maryland, we have heard essentially that people would say, oh, well, they're already giving it to people that are over the age of 65 that don't have any underlying conditions in Florida, for example. And part of that problem is that if you all remember in December, the goal was to have 20 million doses administered by the end of December. The United States fell very short of that goal. Only 4 million doses were administered by the end of December. And part of that problem is that there hasn't been transparent and clear communication as to when someone is eligible to receive the vaccine, where that person can go to get the vaccine, and then if it's going to cost them and how much it's going to cost them, because these are all important considerations that we need to think about. And so you'll see in some states, like for example, North Dakota and South Dakota, who have been severely impacted by COVID, they have done a very rapid rollout of the vaccine and have been able to vaccinate people. Now, granted, they have smaller populations than, for example, those of us that live in Virginia, like you all, but they have been able to prioritize and think about the ways in which they have been able to communicate with people. So part of the issue is that I think there is confusion. People don't know when they're eligible, when it is their turn. They don't know where to go. They're worried about cost and, haven't really been told how much it's going to cost them. And so I think it's all of these factors put together in addition to this idea that it's not coordinated nationally, because it's really up to the state. It's up to your state health department to say, we're going to prioritize in this way. We're going to try to deliver this many doses by the end of this month. That all falls to the state level. And as you can imagine, your public health departments at the state level have been overwhelmed and overburdened since this has all started. They've already, before that, they were understaffed, they were resource constrained, and now the pandemic has just made it way worse for them. And so that's really the reason that it's been so slow in terms of rollout.
Well, and because it seemed like that more people should have been vaccinated by now, and so that is one of the things that we are really focusing on. And I understand that our new leadership that's coming in said that he was going to I guess, do another rollout where all of the vaccines are available. And now I did hear you say that, some people are, I guess, some people are concerned about if they're going to have to pay for it or not. Um, Now, is the vaccines, is it not free to everyone, or do some people have to pay for it, or what?
My understanding and from what I know is that it's recommended, and my understanding is that the most people should have to pay is a copay. I know that there's rumors, right, and I think there's a lot of misinformation, and I don't know if doctors, like if you call your doctor's office and ask, I don't know if they can give you a clear answer. Like they might charge you for the visit, right? So I think that's part of the problem. I think the recommendation is that it should be free to everyone.
Okay, all right, sounds good. We see that children are contracting COVID-19. Why are they saying that children do not need to receive the vaccine?
It's a
Because
great
go ahead.
No, I'm so sorry. It's a great question. I think part of the issue is that the vaccine has not been tested in children, right? So if you think about all of these clinical trials that have been ongoing since essentially January of last year, so we're talking a full year that clinical trials have been ongoing to try to think about candidate products to see if we can get a number of vaccine products out. None of them have included children. And so the recommendation will be not to give it to children at this moment. They are carriers, so they are able to obtain the virus. They are able to pass it on. We have found, however, overwhelmingly so, that children do not fare as poorly as adults. It's very, very, very rare if a child contracts COVID to have a severe case of COVID. And so as a result, the priority first is to get adults vaccinated because we know that adults are seeing more severe cases of COVID. And then the argument will be, hopefully by the end of this year, we will have a vaccine that has been tested in children and therefore will be able to administer to children. So it really has to do with prioritizing the individuals that are dealing with the most severe consequences first.
Okay. Now, will this be a one-time vaccination, or will we have to get vaccinated every year just like we do for the flu vaccination?
It's a great question. I really wish I knew the right answer. What we have heard is that if you get the vaccine, it can protect you for up to 8 or 9 months. So part of it will be how quickly we can roll it out, right? So if we can get enough people to get it, where we can then break the pandemic. Because remember, with a virus, all the virus wants to do is replicate. And the only way it can replicate is finding a susceptible host.
Yeah.
So if everyone is vaccinated, it's much harder for it to find a susceptible host. The problem is going to be, though, if, let's say, someone gets the vaccine like in January, right? But let's say, half of the population doesn't get the vaccine until the fall. So the problem is going to be then the people that got it in January, their immunity is going to be decreasing and they might not be protected against the vaccine in the fall. So then they would have to get it again. So part of it is a timing issue. And I think we're learning essentially as we're going along, right? Because again, we're testing to see how long people have antibodies, which would then indicate that you still have immunity against the virus. And so the plan is, hopefully we'll be able to get enough people vaccinated that it might be you get it every couple years. I don't know, right? We don't have enough evidence yet.
Okay. All right. And one also, and there's another question that it was said that people that have certain blood types are, I guess, less able to contract the virus. Is that true, or?
I don't want to comment on that because I think there's a lot of confounding factors, right?
Yeah.
Help determine that. So I don't know enough about that to be able to say with certainty.
Okay, I understand. All right. What side effects should we expect after receiving the vaccination?
Yes, good question. So most people in the trials, as well as healthcare workers and long-term care residents that have already received at least the first dose of the vaccine, the majority of side effects have been very, very minor side effects. So think about when you get any other shot, hopefully you get the influenza vaccine every year, or you've gotten the shingle shot, if you're over a particular age, it's going to be some pain at the injection site, so where you got the shot. There might be some redness, there might be some swelling. Some individuals have felt kind of not great for a couple of days afterward. Some individuals, very few individuals, my understanding, get maybe a slight fever. And so those are the types of things that you can expect. So I would think very similar to if you get an influenza vaccine, the same type of side effects is what you can expect.
Okay. All right. Good. Between the Pfizer and the Moderna vaccines, which one is more effective and safer?
Yeah, I mean, my argument would be that if you look at the clinical trial data, their profiles are very, very, very similar, meaning they both give you, they confer protection of around 95%, which is really amazing when you think about vaccines. 95% is a great number that you want. Similarly with safety, they had very, very similar safety profiles. And so the good news is because we here in the United States have access to these types of vaccines that are so effective. I would not say that, one is better than the other. They're so comparable from the clinical trial data as well as what we are seeing as people in the population are starting to get them.
Okay. All right. One of the viewers has another question. If a person has already tested positive for the virus and now is feeling good, okay, will the vaccine prevent them from getting it again?
So the vaccine, if you have gotten the virus, you may have some immunity still in your body, but the vaccine will greatly reduce the chance of you getting it again. Remember, the point of the vaccine is that the vaccine trains your body to recognize something that is not supposed to be in your system, right? And so as a result, when the actual virus does enter your body, if you have received the vaccine, your chances of getting it again are very low. So even if you've gotten COVID before, I would argue that it's still very important to get the vaccine because we don't know how long immunity lasts if you've been naturally exposed, meaning you've gotten COVID. We do know that the vaccine is going to offer you a nice amount of protection, I would say, from preventing you from getting it.
Okay. All right. Sounds good. If we could receive only one dose, I know that, they're saying we're supposed to receive two, but if we can just only receive one dose, is it better than not receiving any doses at all?
Yeah, it's a great question. And I think, by getting one dose, you are getting some level of protection. So as I mentioned, if you want to have around the 95% effectiveness rate that both the Moderna and the Pfizer vaccines are able to confer, you have to receive both doses. So if you do receive just one dose, you are still getting some protection. And so my argument would be, I guess it's better than none, right? But we really want to make sure, part of the reasoning that we really want people to complete their doses is because we need that high level of protection. Because if I am able to get the vaccine and then I get both doses of it, and I'm able to know that this is 75% effective, that will also help people around me. So that's the other piece that's very important, right? Is that if I am less likely to get it, that means I'm less likely to pass it on to someone else. But again, that requires individuals to be able to get both of those doses if we want to have that high level of effectiveness.
Okay. And we definitely do not want people to feel that just because we have been vaccinated, that I'm going to let my guard down. Do you feel that we should still take the proper precautions as wearing our mask and continuing to social distance and wash our hands and stuff, even after we have been vaccinated?
Absolutely, Reverend Little, and it's such an important point to make, I would say. We, as I mentioned, and as you mentioned earlier, the rollout process is slow. It's going to be slow. And so until we can make sure that everyone is vaccinated, we still need to continue to engage in all of these because the virus is still circulating, right? So even though you're going to be really protected from getting it, there's still a small chance that you can get the virus because it's 95%, right? So there's still percentages there that you could get it. So it's really important to continue to do that, to continue to social distance, to, not go into public places, not be indoors. I know indoor dining is a really hard one for a lot of people, but that's really one of the main places where transmission is occurring, is when people go into restaurants and are obviously taking their mask off to eat, right? When they're eating, they're allowing droplets to come from their mouth and spread through the air and circulate through the air. And that's what's really causing a lot of the transmission to still occur. And so my argument would be that we understand it's hard to be at home for this long, but if you can do things like be outside, right? You can still try to do some things by doing some outdoor activities. For example, my family, we have been meeting each other outside. We get together on the porch. Our kids play outside, they play on with masks, but it's one way, right, for us to still be able to have that connection and be able to see family. And so if we can think of some alternative activities like that, because I know it can be really isolating and really lonely as well, to continue to not see family and friends and not be able to go to church. It's hard. It's really hard. But I think that if we can do this for several more months, then I think we'll be able to finally get back to being back to normal. It's just that, unfortunately, here in the United States, our cases, we've done a really poor job of being able to manage caseload and severity. And we have seen a lot more death, unfortunately, than any other country because of this virus. So it's just very serious here.
Right. And so you hear that no more indoor dining. Now you've got to, ladies and gentlemen, now you've got to sharpen your cooking skills at home, stay at home, and because that is one of the things that we did hear, that most of the people who's catching COVID are ones who are going to indoor dining. And so listen, we've got to continue to protect ourselves regardless, no matter if we have been vaccinated or not. One of the viewers asked a question: if a person take the shots, can they still catch COVID?
Mm-hmm. So as I mentioned, good question. As I mentioned, you can still catch it, but your chances of getting it are very, very, very small. And so really important, right? Like nothing is 100% proof, right? Is what I would say. But the chances of getting it are really small. And to your point, Reverend Little, the one thing that we've also tried to communicate and talk to community members about, like, even if you don't want to cook, just get carry out, right? Like, get it to go, totally get it. I know how hard it is to figure out and make meals every day. I was telling Reverend Little, I have 2 little kids. It's been exhausting because they have been home since March, and my husband and I both work full time. But we have tried really hard to, we don't see anyone, and it's been a long 10 months. But we know that there is light at the end of the tunnel. And so I think that if we can just continue to do the right thing and really try to protect our communities, that it will at least be able to see our friends and family and not hopefully have to go to a funeral, which has been really, really, really hard. So
yes. And now, of course, me being a pastor, and I know most of the people who are watching are, people that's ready to get back into the church. And some people sing on the praise team or the choir. And I know that you said that indoor dining are one of the main places that are easy to catch the COVID-19 virus. What about churches, those that are singing and choirs?
You're exactly right, Reverend Little, because, it's beautiful and we all want to hear. It's great to my husband sings in his church's choir, and I know he misses it so much. That is how droplets are spread, though, unfortunately. That is one way that individuals are catching it. I don't know if you all remember, but earlier on in the pandemic, they found that a choir that got together and had practice, literally one person was infected. And by the end, everyone was infected with the virus because of this one person, and they were singing in a choir. And because you're singing, right, like droplets are coming out of your mouth, and unfortunately, if someone else is singing and their mouth is open, then they have the opportunity to come into someone else's mouth, right? And so I know it's hard because I'm sure people miss it. And it's been real. Both of my in-laws also sing in their church choir, and they have missed it a lot, but unfortunately, it is a high-risk activity.
Well, like you said, these are some things right now that we just got to adjust to. I know that we are ready to get back into our churches. We're ready to go back out to indoor dining. We're ready to do these things. But right now, we have to stay safe because if we stay safe now, if we continue to do the things that we are supposed to do, if we get vaccinated, we can do these things later on down the road. I mean, this is something that we've got to adjust to. It's been now since March, and so almost a year. And so if we can do it for a year, we can do it a little longer. And so we've got to discipline ourselves to be able to do these things. One thing that I have started to do, and I started it back in March, I have started to walk. I walk maybe 5, 6 miles a day. And it just really is not about losing weight, but it's about taking my mind off of what's going on. It's about um, making myself feel better and to just try to combat this virus with staying in shape and just keeping our bodies healthy. And these are some of the things that we can do as well, you know, eating right and taking the proper precautions and doing the right things. What do you say about that?
I think I think it's so amazing, Reverend Little, that you have been. It's so funny. I have started, I used to go to the gym quite regularly. You know, I have two small kids. So I'd go to the gym kind of late at night after they would go to bed. And that was one thing that my husband, like we used to take turns, and that is something that we have really missed. But you're right. I mean, I do 5 miles a day for 5 days a week. I go early in the morning, you know, I'll listen to like a book that I really want or whatever it is, just to have a little bit of space, right, in your brain to just not think about. I mean, the other thing I would say is that, you know, we've had, if I can be transparent here, you know, we've had a terrible administration, right?
Yes.
The state of the world is hard enough, right? Then you add this pandemic on top of it. And for those of us that, like me, that work in public health and that are fighting against structural racism and understand the importance of all of these different public health measures, this administration has not made it easy. And so I think taking a little bit of a mental health break, that is one thing I would say, is that we have heard issues related to mental health have increased exponentially since we've started this pandemic. I think that we have a number of individuals that are now dealing with severe bouts of depression. We're seeing anxiety. We're also seeing, because of this social isolation and not being able to see friends and family and being able to go to church, people are really struggling. And so I think that if we can think of other things that we can do, just as you mentioned, if you can be active, if you can go outside, you know, allow the sun to shine on you. Take a minute. It's mental health is extremely, extremely important. And you're right, just trying to eat right. I think a lot of family and friends that I've spoken with have been like, oh my gosh, I learned how to cook during the pandemic. I never did it before, but now all of a sudden it has allowed me to have this time. And so I think that we need to continue to connect, though, is my argument as well. And I know it's hard over Zoom, but it's really important to make sure that you're still able to connect with friends and be able to talk about things, because we have seen huge increases in sort of suicide attempts, as I mentioned, depression and anxiety. So really, really important.
Yes. There are a few questions that our viewers has put on. Our producer will put them on the screen now to we just take a few of those. If temperature are being taken, can a person still have COVID even though they don't have a fever?
Yeah, it's a great question. They can still have COVID. So remember, the symptoms that are outlined through the CDC or through your state health department that say that, you know, these are the types of symptoms you may experience. I think what we have learned is that people experience very, very, very different symptoms, right? I have had colleagues that have said, oh, I've seen patients that had literally no symptoms. Then you have patients that have a fever and that have coughing and that lose their sense of taste and smell, right? Then you have people that have a combination of these things. And so I think that if you decide to go to places where they're doing temperature checks, right? I think that it does allow to have some sense of security, I guess, because then someone with a high fever that is definitely contagious is not there. However, that does not mean that you or whoever got their temperature taken, and if they don't have a temperature, that doesn't mean that they don't have COVID. They could still, unfortunately, be carrying COVID.
Okay. Is there another question? How effective is the vaccine if you don't get the second dose in a recommended time frame?
Yeah, so the way that the clinical trials were run is that they looked at the optimal time frame, is the word I would use here, between the first dose and the second dose. And if I remember correctly, I don't remember which one is which for Pfizer and Moderna. One is 21 days and one is 28 days, I believe. Is sort of
Yes.
Okay. And so I think that there's some leeway there, is what I would say. So I don't think you have to get it exactly if you get the one that needs 21 days in between. If you don't get it exactly at day 21, I still think you're okay if you wait for a little bit. But as you continue to wait, you start to see less protection. And so that's why it is important. That's why those recommendations are there. That's essentially telling you that this is how the vaccine can essentially be used in your body optimally. So that's why I would recommend to follow the recommendation with regards to duration between doses.
Okay. All right. Well, I tell you, I am ready to get vaccinated. I'm hoping that those who are listening tonight are ready to get vaccinated. And whenever it's time to get vaccinated, don't hesitate, do it. We've had some very great information here tonight from Dr. Rupali. She has really blessed us. And so she is a vaccine specialist and she knows what she's talking about. And so, listen, I know that many people are still skeptical, but we've got to do this. We've got to get back to activity as we used to. I'm not going to say get back to normal because some things that we are doing now, we've learned to do a whole lot. We've learned to do things better now than we've been doing it. And so it's good to be able to learn from what we have experienced, but we've got to get back to doing some of the things that we used to do. And so the only way we can do that is to continue to practice safety, safe distance, continue to wear our masks, even when we're vaccinated, until we are told different. And so we are so thankful tonight, Dr. Rupali, for just coming on and shedding some light on getting vaccinated. And so in closing, what is something that you would like for us to know tonight in closing?
You make some really excellent points. And I think the best thing I can say to you is that if you do have questions, first of all, it's okay to have questions, right? We're living in a weird time. So don't be embarrassed if you have questions. Make sure that you can talk to someone that you trust. The other thing that I would say is that please, when you're thinking about the vaccine, and if you have questions about whether you should get it, whether a sibling should get it, whether your mother should get it, that you do talk to an individual that is knowledgeable about the vaccine process. The one thing that we are fighting a lot against right now, particularly in the work that I do, is misinformation. And there's a lot of misinformation out there. And so please make sure that you are thinking about who you are speaking with. If you're looking at things on Facebook, make sure it is verified. If you're looking at Twitter, any other social media platform, that you're talking to someone that you trust, that understands the scientific information, and that, again, we understand we're living in an uncertain time. And so it's important for us to try to think of the ways that we can get back to quote unquote normal. I think we all want that. We're all aspiring towards that. And the only way we're going to be able to do it, though, is to make sure that we're checking in on each other and that we're just being there for people as they're sort of struggling through all of this, whether that's losing a loved one to COVID, being in the winter, having just seasonal depression, all of these things that I think that people are dealing with. It's really important to make sure that we're there and we're here, we're looking out for one another, really.
Great. Dr. Rupali, there's one more question someone has just put up. And so I'm sorry, but if you would put that question up for me. If a person take the shots, can they still? We already answered that.
Yeah.
Yeah, we already answered that question. So I think that is it. How long will the vaccine work?
Got it. No, so that will be, we think right now it provides immunity for about 8, 9 months, is what we have so far figured out. And so I think only time will tell. I think we're learning as we're starting to administer these doses, but for right now, it's a nice amount of protection. It's not just a couple of months, it's several months. And so fingers crossed that we continue to see that.
Yes, yes, yes. Thank you. Thank you once again for joining us. And I want to thank Bishop Moore for just encouraging us the other night to reach out to you and the other medical staff that was with us the other night to just come in and just talk to our congregations, and to not only to just the congregations, but to people in general. And so I know that we've had more than just our congregation looking tonight. We've had other people looking and listening. And so once again, I want to thank you for just blessing us tonight. And make sure, like she said, make sure that we have the proper information off of Twitter and Facebook, and make sure it's credible information, and make sure that it's information where people are giving you are professionals. Everybody wants to be a professional, but they are not in that profession. Listen, I am a pastor. There's nothing I know about vaccine medicine. And so if I want to hear about vaccine medicine, I will call Dr. Rupali and ask her about it. If you want to know about ministry, then you can contact me and we can talk about that. And so listen, talk to people who are professionals in what they're doing, and take the information and advice from credible people. And so thank you again, Dr. LeMay, for just coming on and being with us on tonight. And remember, everybody, thank you for joining Just a Little Talk. And remember that just a little talk will make everything all right. Thank you. Have a wonderful day.